Question number 3. Klumpke's palsy, the lesion involves is C5, C6, C7, C5, C6, C8, T1, C7, C8, T1. A very important and very simple, easy question. This you're saying is brachial plexus, and all these roots are actually the anterior primary rami of these spinal nerves. And the site of injury in Klumpke's paralysis is this, the lower trunk of brachial plexus. And the spinal segments contributing to this lower trunk are C8 and T1. And these C8, T1, they run along the medial cord of the brachial plexus through its anterior divisions into the medial cord and through its posterior divisions into the posterior cord. But through the posterior cord, these segments C8 and T1 reaches only up till the dorsum of the hand in the form of cutaneous distribution to the superficial branch of the radial nerve. That is the cutaneous area overlying the anatomical snuff box and the lateral half of the dorsum of the hand. And through the medial cord, it gives out branches, the medial pectoral nerve, then medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and finally, medial cord continues as ulnar nerve. So talking about Klumpke's paralysis, remember that's a complete claw hand. The reason being the 20 intrinsic muscles of the palm, out of that 15 intrinsic muscles are being innervated by ulnar nerve, including the third and fourth lumbaricals. While remaining 5 intrinsic muscles, they are innervated by the medial root of median nerve that includes the AFO, abductor, flexor, and opponens pollicis brevis of the thenar eminence, as well as the first and second lumbaricals. So when all these 20 muscles are paralyzed, basically when we talk about claw hand, we are considering the 12 muscles, the 4 lumbaricals, 4 palmar, and 4 dorsal interossei. So these 12 muscles, when they'll be paralyzed, they'll be a complete claw hand. Remember that. While out of these 12 muscles, only 10 muscles are being innervated by ulnar nerve. First and second lumbaricals are spared if we're talking is about the injury of ulnar nerve in the Gwen's canal or injury of ulnar nerve at the wrist. So at that time, 10 out of these 12 muscles will be paralyzed. First and second lumbaricals will be spared. And that's why due to ulnar nerve injury at the wrist, there will be a partial claw hand or ulnar claw hand. The clawing on the index in the middle is little but released. So that's why remember this, the difference between ulnar claw hand, which is a partial claw hand, and in Klumpke's paralysis, there is a total claw hand deformity. So answer here is Klumpke's palsy, the lesion involves is spinal segment C8T1.